pharmacological treatments don't work, and we really need more scientific evidence. My presentation was about available treatments for complex trauma disorders, specifically dissociative identity disorder, and I was looking at the limitations of the evidence because all treatment modalities are not studied equally. The problem arises with the complex PTSD because the studies don't want to include people who have many comorbid conditions. They may have depression, anxiety, substance abuse, features of an eating disorder. These people do not get included in the studies, so there is no evidence base for the treatment of the very severe disorders. If we go to the non-RCT empirical data about treatment, looking at treatment packages that aim to transform rather than regulate, we see that sensory motor, somatic experiencing, EMDR, brain spotting, and CRM all have significant inclusion of the body feeling. The existing modalities for the treatment of complex PTSD sometimes cause the person to be overwhelmed, for example with fear or rage or grief, and often that can lead to further dissociation, and then the person can't stay with the emotion, the distress, long enough for it to change. We need to know what emotions might be experienced as overwhelming at the time of the trauma, and the emotions that arise during the processing of these past experiences. The comprehensive resource model is a model for allowing access to the deepest pain by building a scaffolding of resources around the person who then is able to go safely and gently, comparatively, able to go into the deepest pain held, even from, earliest infancy. Clearing the negatively valenced or distressing emotions leaves the person open to the experiences of the positive emotions generated in the midbrain as well as those generated higher up. So it leaves our patients then open to the experiences of seeking attachment in a way that is not painful, finding joy from that, seeking happiness, play and love. And that seems to me like a good aim for psychotherapy treatment. We need more research, we need more clinical studies that involve modalities for treatment other than the accepted ones, the ones that are currently in guidelines.